Hello and welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, July 24, uh, 2024. I'm Grisel Rodriguez Morales, Rush Generations Program Director. I'll be your moderator for today's lecture on summer safety with one of our esteemed Rush Generations colleagues. Before I present to you today's speaker, I'd like to first thank our lecture producer, Hannah Weisman, as well as Franco Sambataro, who's stepping in for Hannah today and will be helping us manage the chat and other key aspects so that we all can have a great discussion. As always, we are live streaming this lecture via our YouTube channel, where we have dozens of other health education lectures that you can always refer to. Please feel free to let your friends, family, colleagues know about our channel and any of the other lectures that we've offered, so that they can also benefit from the valuable information that our speakers offer through Rush Generations. We are using the video platform Zoom, which also allow us to host a good number of people who join us via phone. For those of you on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion through the lecture. We will make sure that your comments and questions make it to Janine. And for those of you listening to the discussion via phone, you will also have an opportunity at the end to unmute your audio so that you can ask your questions. Thank you so much to all of you for joining us today. We'd like to remind you that the information offered here is for general informational purposes only, and to always seek additional professional advice for situations specific to you and your needs. Okay, and without further ado, I'd like to introduce you a little bit, give you a little bit more information about Janine. She is a licensed social worker in the Department of Social Work and Community Health. She provides social work services at Rush and out in the community, specifically at 3 Chicago Department Area on Aging and Family Support Services senior centers. She's a highly skilled social worker in motivational interviewing for our evidence-based programs. She also co-facilitates a monthly caregiver support group that we offer here in collaboration with the Alzheimer's Association. Janine is dedicated to fostering awareness, advocacy, and education about fall prevention as a master trainer for Matter of Balance and as an instructor for the Tai Chi for Arthritis and Fall Prevention program. She was excited to debut the first advanced Tai Chi Arthritis and Fall Prevention workshop just a few months ago in January of 2024. Janine, thank you so much for joining us today and for offering more invaluable information to our Rush Generations members and the general public.
Thank you, Grisel. That was such a lovely introduction.
You're welcome.
I really appreciate that. Well, I work with a lot of individuals, as Grisel said, both at Rush, through my programs, out in the community. So it's really a joy to find this virtual community in which I can speak on a topic that I think is very important. It's also a perfect time of year for us to be talking about this. We're halfway through the summer. People are out enjoying their families, parties, pool parties, swimming. But with all those activities and all those celebrations go chances, we hope not, to you and yours, for something to happen that is a safety event. We could call it a safety event. So I'm going to go through quite a bit of information. And if you find just one nugget that inspires you to think differently about how to stay safe in the summer for you, your family, your friends, then that will make me really happy, and you will feel that you have some valuable information. Next slide. Okay, so I've broken up this presentation into 3 different areas. The first is water safety. The second is heat safety. And lastly, but not least, is sun protection. Next slide. So that one is over there, over the open, but what that reads is open water and pool safety. So I'll be spending quite a bit of time on water and pool safety and look forward to sharing information and statistics with you. So I'm very humbled by this statistic that over 4,500 people in the United States died due to drowning each year from 20 to 2022. Thinking of all the families that suffered loss, and in ways that we know we can look at water as a hazard, but also a place for fun. And then we try to find the balance between the two so that we're aware and we're also able to enjoy our time in the summer in the water. So there were 500 more drownings per year compared to 2019. So you can see between 2019 and between 2020, 2022, that was a significant number of individuals who unfortunately died by drowning. So, and an average of 3,500 to 4,000 people, as I said, drown each year, and that is an average of 10 fatal drownings per day. So that's multiplied again by probably 365. And this is very disheartening statistic that drowning is the leading cause of unintentional injury-related death for children ages 1 to 4. But I think by learning some more through this presentation, we'll be able to feel more confident about ways that we can support, especially that particular tiny age group that they are. Next slide. So the statistics that I shared also include boating-related drownings. If you're anywhere, if you live in Chicago, you're near lake or water, you always will see a lot of boats moving around. There was recently a drowning in Chicago that I heard about that was due to boat safety, or it was unfortunate to hear that. So this is an interesting statistic because when we think about drowning, there are still 8,080 non-fatal drownings each year. So you can imagine how fortunate those people are that did survive the drowning, but the terror to feel and experience what it's like to drown is, but they survived. That's why it's referred to as a statistic, because someone did come close to drowning, but they didn't, and that's very good news. So that is an average of 22 non-fatal drownings per day. And again, there are approximately 11 drownings per day. I just want to share personally that I almost drowned when I was 3 years old. Apparently, I fell into a pond at my grandfather's house. And then from there, my father was able to come and scoop me out in the nick of time. So I have had that experience. I don't remember it, but I do remember a time that I was caught up, not in a riptide, but in a very strong surge of water. And I did become really frightened, and I was able to hold on. The wave kept bringing me toward the shore and back out further. But finally, on the last time that I went toward the shore, my friend's husband was there, came to the beach, held out his arm and pulled me out, because it's very fatiguing when that happens to you. Next slide. Okay, so talking about children, this is an area where I have information that I think will hopefully be really helpful to you and your family. So 75% of fatal drownings from 2016 through 2018 involve this very tender young children who are younger than 5 years of age. And the statistic that really stands out is that 83% of those were at residential pools. So fatal drownings for children increased from 2021. It increased by 12%. That's the most recent data for which data is available compared to 2020. So we are seeing a rise. So I think I was like the first one to volunteer to give this talk because I think it's so important to know that there's so much we can do to prevent these deaths from happening. Drowning remains the leading cause of death among children ages 1 to 4 years old, with a disproportionately higher risk for swimming-age children in Black communities. Next slide. So I found this information that the Consumer Product Safety Division urge families with young children and those in historically excluded communities to prioritize water safety while spending time in and around the pools. Next slide. So a few more statistics to put this all into context. So drowning remains in the top 5 causes of unintentional injury-related death from birth to 5 years old. And 23% of the child drownings happen during a family gathering near a pool, hence that other statistic that we saw, 83%. And drowning is the cause of death for most boating fatalities. I don't think I was aware of that, and I hope that that is a helpful statistic to know should you be heading out on any boats this summer and ways that you can stay safe. It's also estimated that another 5 to 10 people receive hospital-related care for non-fatal drowning injuries for every fatal drowning victim. So every time there's someone who succumbs to drowning, there are 5 to 10 who were receiving care and hopefully appearing that they survived. Children younger than 1 year old are most likely to drown at home. And that could be, the child is in the tub or maybe got into some water in a bucket. We know that water issues in the home are also very important to consider, especially if you have a child of this age or younger. And children ages 1 through 4 are most likely to drown in swimming pools and bathtubs. So yes, the bathtub is listed here. And lastly, children 5 to 17 years old are more likely to drown in natural water, such as ponds or lakes. So we can think about where they are in their stage of life, and as they become older and more mobile and confident and may not be spending as much time with their parent, or who knows, there are any number of variables. It's a much more mobile group, so they may go fishing or let's go row the canoe in the lake. So they're doing other types of water activities that could actually lead to an accident. Next slide. So this list can give you some solid ideas about prevention strategies for a safe summer. Wherever you're doing, however you're celebrating, if it is around water, either open water or around a pool, a lot of pool parties this time of year. So if a pool is in your area or close to your home or perhaps in your backyard, given that statistic for the 1 to 5 year old children who are a very high statistic, one could install a 4-foot fence with self-closing safety latch. So the child would not be able to reach it. It's usually locked at the top of the fence, so it's not like, one of those easy latches. One has to be able to, like an adult can stand there and lift up the latch and allow the children in or the guests. So safety proofing the best way one can around a pool that doesn't have a fence can go a long way to feeling confident that we're going to be managing the creation of a safe place for visitors, guests, our children, family members, etc. I cannot emphasize this enough. An adult should be present at all times on the pool deck surveying pool activities. I personally had access to a pool while my children were young, and then they'd invite friends, and all of a sudden, there are two kids in the pool, and now they're, 15. So my friend and I were really we were really motivated that we were going to always assign an adult their only job, and then we could change shifts, was to stand on the side of the pool or sit there and watch the children and make sure that nobody was, heading underwater and needed assistance. So this is a very easy way to create safety in your pool. If you have a very large pool, you might want to see out. Perhaps if you know someone, or can reach out to the city for a lifeguard. But that is probably, I think, the strongest tip that I can give around pool safety. Also, head counts. How many children went in? How many more are now going in the pool? Doing a head count can also just be a very concrete way to keep track and make sure that all the children are fine and nobody's underwater. We don't want that to happen. Also, safety gears. You can have, fortunately, I think prices have come down on some of these safety tools that one can purchase. A life preserver, flotation device. I'd be careful of floating mats, because we don't know, perhaps if a child might get stuck under the mat and the mat, like the inflatable raft, and they're having trouble getting out from underneath. So there's a lot to manage in that, but there are many, many solutions to help, as you can see here, to keep safe.
Jenny, can I
Also,
ask a
another
question?
cause of
Is it
drowning. Sure,
Jenny, can you hear me? There's a little bit of
I can.
audio. There's a little bit of audio issue, so cutting in and out. But I think that your pace is helping, because making sure that you're slowing down, that has helped. But Jen, are you saying that then it's better to use those noodles, flotation devices, instead of the mat, because otherwise you are blocking the view? Is that what you were trying to get at?
I think, yes, thank you for clarifying, and I hope that I can get the audio to
That's
sound
okay.
better.
Just keep going
Okay.
slowly, and maybe not move too much. But I think we're getting the gist of everything.
Okay, thank you for letting me know. So to answer your question, if it's really young little people, you probably don't want the mat. But if it's older children, they'd like to play King of the Raft, or it's fun. So those that are more, they can swim, but you may have a variety of ages. So you really want to focus on that 1 to 4 to 5 range, but really just any child that's in the pool. And I, again, cannot recommend highly enough having one adult or two that are simply there to keep their eyes and to do head counts.
Mhm, mhm.
Another area, and I have heard of this happening, where you have a bucket of water and you're at your house and you're getting ready for a party, and maybe there is no pool, but somebody left a bucket of water out, and the child actually can drown by falling into the bucket and may not be able, there's no way to articulate that they're in distress. So think about any kind of material that can fill with water. Like if you leave a raft out in the rain on your deck, when the next morning you're going to see it filled with water. So we want to turn those over so they don't become a drowning hazard. I hope that makes sense. So buckets, kiddie
Yep.
pools, you've seen them. Yeah, they're sometimes bright blue. You want to turn them over. We just don't want the child wandering out in that way and finding themselves in that, that whatever that is, that inflatable pool.
Mhm.
And the other area, as a parent or as a friend, just for yourself, so you can help others, is to learn CPR, and you can contact the Red Cross. Another option might be your local YMCA, YWCA. So the more we can educate ourselves about having a plan before we have our gathering, who's going to take turns watching the children, who's going to count them, This is going to help your party feel great, you'll feel confident, and you have a plan. Next slide. Okay, that's just what I said. Plan, plan, plan. You know, we want to be spontaneous in the summer. It's a great day. Call all your friends. Everybody, let's jump in the pool. But really thinking about the age of the individual, if anybody has a disability that may need assistance. So advanced safety planning is key. You can check and consider, is there a fence around the pool? Again, one recommended with a child safety lock. And you also might be able to assess how many adults and children in the pool are you comfortable with for optimum safety. For some people, it might be 10, for others, it might be 20, depending on the age of the participants in the pool. Also, again, I talked about item 4, and just again re-emphasizing the Red Cross or YMCA or YWCA as resources as well. Next slide. Okay, so this is a statistic about a riptide. And if I will have a graphic on here to show what a riptide looks like. Lifeguards rescue tens of thousands of people from rip currents in the United States every year, but it's estimated that 100 people are killed annually by rip currents. And as I was doing research into this presentation, I heard a very sad story about a family that was vacationing. I can't remember where, but it was I believe in the United States at a beach. They were at a resort. The couple, the mother and father, had 6 children. I don't know the oldest, but I know there was an 18-year-old. The mother and father went out into the water. This really happened just a few weeks ago. And they got pulled out by the riptide. And the oldest son was on the beach telling them that he's pointing in the direction, basically trying to signal, swim parallel to the beach. It seems counterintuitive, but it appears that they panicked and they both succumbed to death. They lost their parents, all 6 children, just a few weeks ago. So I really wanted to take a moment to talk about this because we do have riptides in Lake Michigan, but with knowledge and understanding of, a lot of the public beaches will have their flags up that it's unsafe to swim. We should really consider not swimming on days that those lifeguards are putting those up as warnings to not go into the water, and that's for your benefit. Okay, next slide. I found this graphic and I thought this was a very good one. So if you look at this image, you'll see the beach and you'll see 2 arrows going out, one to the left and one to the right. And in the middle is the straight arrow. So this is important to know. Should you get caught in a riptide, as is possible, you want to try to relax as best you can and let the riptide pull you out, because eventually the riptide dies away and you're able to swim to shore, or you're able to swim. What you want to do is follow the arrow. So if you are ever stuck in a riptide, you want to try to relax, not panic. It's when people panic that this can be a very challenging moment. You want to just try to breathe, let the water pull you out. And as it should start to lessen, the riptide doesn't go on. It may go 100 yards, it may be less. Or you may just, even in the midst of it, be able to break out of it by either swimming to the right or to the left. So I hope that this image makes it clear. You can see the gentleman there. He's been pulled out and he's now swimming to the other side. Giselle?
For the colors, and then what we are saying that instead of trying to swim towards the shore or the opposite side, then swim either facing, is if you're facing the shore, then you are either deciding to go to your left or to your right, but not forward or backwards, right?
Yes, because you'll still be in the riptide. Now, it may be that you're unable to swim right or left. And once you get through that riptide by going right or left, you'll be able to swim comfortably back to shore. So you're going out to one side so that eventually you're out of the riptide and you're able to swim back to shore. It's again when people panic and they're hyperventilating that they're at the highest risk to have possibly succumbed to the riptide. So cannot emphasize enough that we do have them in Lake Michigan, but not to be afraid. You should keep this image handy. Maybe share it with family and friends, because we all want to educate ourselves so we can enjoy our beautiful lake and our beautiful summer. And the statistics again show that this is the way to get out of the riptide. I hope the audio is improving a little, Griselle. All right. So it's also interesting and not surprising. There are so many individuals in the United States who don't know how to swim. And I can share one more personal story. My mother grew up in McAllen, Texas, and she is Mexican. She was Mexican. Well, she's passed away, but she talked about that she wasn't allowed into the pools because she was Mexican. And so my mother never learned to swim. She did like sitting on a deck, sunset. So she wasn't afraid of the water. She just never learned to swim. So I do want to dedicate this presentation to my mother, because my parents really understood the importance that my brothers and I have two brothers, that we do learn to swim, and we learned at a young age. And so fortunately for me, I feel pretty confident in the water, but I try to be aware as much as I can. But looking at the statistic, only 40 million adults, so that's about 15% of the United States citizens or non-citizens, do not know how to swim. And over half, so more than 50%, have never taken a swimming lesson. More than 1 in 3, 36% of Black adults reported they do not know how to swim, compared to 15% of all adults. And this last statistic from the CDC, 2 in 3 Black adults at 63%, and 3 in 4 Hispanic adults, 72%, reported never taking a swimming lesson. So there are barriers perhaps, or perhaps there are individuals who don't feel confident learning to swim, or maybe they're afraid of the water. I think we honor everyone's decision if they choose to learn to swim or not. But I do think that if anyone can learn to swim, it is wonderful to be able to swim, but also be able to help family members should they ever be in distress. But again, it's a personal choice, and we value and honor that. Next slide. Yes. So Red Cross, I just want to put this as a separate graphic. YMCA of the USA, and you can go to this USS, it's usswimschools.org, to find learning to swim programs. It's never too late to start. That's what I can add to this slide. Next slide. Okay. So I'm going to turn now to sun safety. So while we love being out in the water, it is really important we think about how to care for our skin and think about ways to keep our bodies safe, because we know also, I don't have a slide on this, but we know that our heat is, the climate is rising, the heat is rising. So we want to really protect ourselves. And so I created this slide, what you should know about sunscreen. Next slide. apply sunscreen. So I sort of made this a standalone for those of you on the phone where you see a gentleman or a woman squeezing some sunscreen into their hand. Apply sunscreen. It's that simple. It can be, there are a lot of different SPF numbers. You can figure out which is the best for you or talk to one of your providers. Next slide. So I did not realize this, so I'm glad to add this to the talk today. The most common cancer in the United States and worldwide is skin cancer. So 1 in 5 Americans will develop skin cancer by the age of 70. More than 2 people die of skin cancer in the US every hour. And having 5 or more sunburns doubles your risk for melanoma. And when detected early, the 5-year survival rate for melanoma is 99%. So I am a social worker, not a nurse, but I do know that one can go and to a dermatologist and have their skin checked annually for any signs of melanoma or emerging melanoma. Next slide. So the exclamation point is on SPF matters. That's the level of concentration that protects you from the sun. You would want to look for a sunscreen that most likely has a good SPF, and if you're planning to be active, like running where you're building up a sweat, to make sure you reapply, but I'll be talking about that in a minute. So it's recommended to apply sunscreen to exposed parts of your body 15 to 20 minutes before sun exposure to absorb and provide maximum protection. What happens on a sunny day, it's like, oh, it's great outside. I'm just going to slap on some sunscreen and jump in the water. Well, that's going to wash off. So I think the most important way for sunscreen to be effective, and I'm going to practice what I preach, is that we wait 15 to 20 minutes for it to absorb. Maybe put it on with your morning coffee, and then, in a half hour, you're going for an outdoor walk, you're ready to go. And then you can also consult with your pharmacist about the optimum SPF number for you. There's also quite a range, an array of sun protection clothing. I've seen some on Amazon. So there's a shirt you can wear, and it acts as sunscreen, but it basically is there to help keep your skin from absorbing the sun's rays. And they have them for arms and legs. I'm sure that there are some hats that are SPF hats. So you can really consider that if you are like, well, I don't want to put all this sunscreen on. I know this is going to be good coverage. And wear a hat to cover more sensitive skin areas such as your face. Next slide. So again, about reapplying sunscreen every 2 hours. And that's especially relevant if you're outside, you're perspiring or swimming, and it's worn off. Because the effectiveness will also wear off. So again, I talked about checking in with your provider. I'm sure as we age, we develop, it's possible that our skin is maybe not as resilient. So perhaps someone who's, a little bit older may want to talk to their doctors to make sure they're getting the best coverage for their skin. And always drink water and stay hydrated. And okay, so I also included this from the Yale.org source, that if you're indoors and away from the windows and not sweating, you probably do not need to reapply before you go outside. It's not like we have to be putting it on all the time, but considering the environment that you're in. Next slide. Now, it is worth noting you can plan your day around the sun. So if you're going out for a picnic, maybe the best time is not to lay out a blanket and all your food is out there and there's no shade coverage and it's peak hour and it's 12 p.m., it's noon. That does not sound like a really good way to be, hot in the sun, and, you may start perspiring in your sunscreen. So you might want to think about avoiding sun exposure, especially during peak hours, such as high noon, and enjoy,
Sorry, can you
consider
repeat the
at
peak
least
hours?
enjoying outdoor.
I don't think we got that.
Yes,
Is it 9 to 4?
sorry
Did
about
you
the.
say 9 to 4 or 10 to 4?
Yes, so you want to enjoy outdoor activities early in the morning or in late afternoon when the sun's rays are less intense.
Got it.
Could you hear that? Yes. And it's actually cooler at those times of days. So consider maybe that range from like 11 to 4, 3 or 4 as maybe that, perhaps given the weather, may be a very intense Sunday. So you want to wait till, the sun starts moving across and it's not just high noon. Okay, next slide. Got to be mindful of time. Oh, we're good. All right, this is just a quiz question. Should you wait 15 to 20 minutes after applying sunscreen before going outside?
True.
Next slide. Ding, ding, correct. Yes. All right, so that's what I had to share about sunscreen. So now I'm going to go to heat safety. Next slide. I don't know about all of you on the phone or out there. I have actually had a heat stroke, when you don't even realize you've been outside and then you start to feel rather woozy and really not like yourself. And it's quite not a good feeling. So I'm not a physician or a nurse, but this is information I thought would be really helpful, especially because, as I mentioned, our climate is warming. So we really want to think about time of day, what I'm wearing, what can I do preventatively, but what are some ideas that I can use if I do wind up with heat stroke. So heat stroke, you may be aware, is when the body can no longer control its temperature. As the body's temperature rises rapidly, the sweating mechanism fails and the body is unable to cool down. So I think this is a really good description, because if you think about it, the body's not working to bring the temperature down. It's risen so quickly. And the body temperature can rise to 106 or higher within 10 to 15 minutes. So one might develop heat stroke. Let's say you went to an outdoor concert, weren't wearing a hat, it was supposed to rain and it didn't, and now it's super hot. Maybe you don't have access to like a coolant beverage. It could be a opportunity, which is not really an opportunity, to develop heat stroke. And sometimes you don't know you have it until it comes over you. Next slide. I thought this was a nice infographic I found from National Institutes on Aging and National Institutes of Health. So I'll highlight a few items here. So if you're at that concert and you pass out, that is a sign that you are having heat stroke. Also, if you're out with someone and this can happen a lot on a boat. You may be like anchored. People like to take boats out and they're rocking all day and they don't realize how much heat they're exposed to. They may become confused, agitated, acting strangely, not in their typical presentation. So a change of behavior is one way to consider. Oh, I think we need to try to help my cousin right now. I think that person has heat stroke. So heat stroke, if you have it, you need to get medical attention right away. Also, for older adults living in homes or apartments without air conditioning or fans, that they are also at risk. People who become dehydrated or those with chronic diseases or alcoholism are also at most high risk. I also want to thank Rizal in the introduction for mentioning the work I do in community at Department Area on Aging, City of Chicago Senior Centers, because during a heat wave, those centers, and you can look them up by zip code in your area, become cooling centers in the summer and a warm place to be in the winter as well. So just know there are quite a few resources for those who do not have air conditioning in their home where they can go to cool off. Again, body temperature over 104 requires attention. And if the person is with a weak pulse, you really want to get that person most likely to the hospital. And if they are outside, if someone's outside and they're not sweating, that might be another indication to act on as soon as possible. Next slide. Okay, so I'm going to go through this. And again, this information, it's a lot, but if you take just 1 or 2 points away for what you can do with sunscreen, what you can do to help avoid heat stroke, all of this will, and also to prevent drowning, to swim safely. If you take one from each bucket, I'll be super proud of you. And then this slideshow will also be made available through the Rush Generations Network if you want to review it again. So risk factors for heat stroke include heart or blood vessel problems. Our glands may not work well, our sweat glands. So that can happen, and that can be caused by normal aging, heart, lung, or kidney disease, as well as any illness that may feel weak over or results in a fever. So you may feel weak all over, you're wondering what's going on. That could be a sign of heat stroke. Taking several prescription medications, if you are susceptible to heat stroke or perhaps don't have the most robust or without that, you ask your doctor if any of your medications might make you more likely to become overheated. Always talk to your doctor. If you can't get the doctor, talk to the nurse. There's always somebody there that can answer a question, hopefully for you, with when an issue becomes one that you really want to understand in a deeper way. Other signals that one could be at risk for heat stroke are being very overweight or even underweight, and drinking alcoholic beverages while you're out in the sun. That can be a really dangerous combination. Next slide. So now we're just some points on heat exhaustion. So heat exhaustion is a warning that your body can no longer keep itself cool. So the body is sending you a signal, it just can't do this. So you might feel the following symptoms. The symptoms can range from feeling thirsty or dizzy, uncoordinated. You might feel nauseous, but you also may notice that you take your temperature, it's the same, it's normal, but your skin may feel cold and clammy. So should this happen, we want to try to address that as soon as possible. Some ideas are to rest in a cool place, get plenty of fluids. You might want to put a very cold compress on your forehead, other parts of the body. If you're not recovering in a certain period of time, then you should reach out to your healthcare provider, or if it's really progressed, perhaps go right to the emergency room. And also a warning that exhaustion can progress to heat stroke. Next slide. Don't you just want to take a breath and pause? Listen to your body. Grizel mentioned I teach Tai Chi, and I focus a lot on the breath and asking ourselves, how am I now and where am I now? Now, I use that for fall prevention, thinking I'm at the grocery store, there are a lot of people around me. But when you listen to your body can be your guide. And it certainly can be if you're starting to experiencing any of the heat symptoms that I've just discussed from the slides. So listening to your body's always with you, and your body will be your best guide to hopefully figuring out what you're experiencing and how you can help remedy that so you feel better as soon as possible. And it doesn't turn into an emergency. Next slide. I won't spend much time on this. I know I want to keep us to time, but heat syncope, I believe it's pronounced, or fainting, it's a milder form of heat illness that often results from physical exertion when it is hot. So it occurs when your body, in an effort to cool itself, causes the blood vessels to dilate, and it needs hydration. It needs hydration to plump us up, and we want to avoid developing any illness around this. So again, resting in a cool place, putting your legs up, drinking water. If the symptoms don't resolve, call your doctor or 911. Go to your nearest emergency room. Again, what's happening here is the blood vessels are dilating. And so it's a bit complex, but it's to dilate to such an extent that blood flow to the brain is reduced. So we want to try to, the minute you have symptoms, less is more. Have some items perhaps already in your fridge during the summer, like a cold pack. You can buy those at any drugstore, supermarkets. You put them in the freezer. They can be really helpful to help bring your body temperature down, along with ice and other remedies. Next slide. Okay, so solutions. I like our little smiley face. We want to consider drinking plenty of liquids such as water, fruit juice, vegetable juices, but water is always a good number one. Stay away from drinks containing alcohol or caffeine, especially if you're going to be out in the sun. If you live in a home or apartment without fans or air conditioning, try to keep your house as cool as possible. Limit use of your oven. So it's a hot day, and maybe if you don't have air conditioning, you really probably don't want to turn the oven on because it gets very hot. So keep your shades, blinds, or curtains closed during the hottest part of the day. We talked about that as that time from about 11 a.m. to maybe 4 p.m. That's the time of day you want to, if you are having challenges with air conditioning or it's hot, close all the blinds. And if your house is hot, try to spend some time during midday, someplace that has air conditioning. You could take yourself to a movie, to the mall, to our senior centers that I mentioned, a library, a friend's house that has, maybe their air conditioning is working. So just know that you have a plan, you can prepare for that in advance for who would I go see, what would I do, maybe make a plan with a friend or family member that they would be okay with you coming to visit should the heat rise again to very dangerous levels. Next slide. Right, I just said, ask a friend or relative. I liked this one tip here is that if you're gonna wait for a bus, if you have an option to stay inside while you're waiting for the bus, that would be ideal. You want to think about the clothing you're wearing. If it is hot and you're waiting for that bus and you know your bus takes half an hour, maybe try to get there just a few minutes before you know it'll come. And again, don't try to exercise and do a lot of rigorous activities outdoors when it's hot, and avoid crowded places when it's hot. So plan your outings around non-rush hour times. Next, I think we're almost at the end. Yes. Again, if you are feeling any of the symptoms described, call a friend, listen to your body. You can call 911. Yes, all these recommendations, read labels for expiration dates for medications and sunscreen is another really good suggestion. Next slide. Finally, last but not least, and I'm sure many of you do, wear a hat. Cover your head to avoid sunburn, irritation, or third-degree burns from the sun. That gentleman looks very sporty, but he's also keeping himself very safe. And next slide. Enjoy a safe summer, everybody. Thank you so much for attending this talk today. Planning goes a long way. And I wanted to make one last announcement. I read that there are now enough lifeguards in the city of Chicago to cover every beach. There was a decline during the pandemic, and the city has worked on an effort to even train individuals who don't know how to swim to swim, and they had a large application pool. So you should have a lifeguard at your nearest beach, and if you don't, I suggest you call your councilman or alderman or the city department to see why there isn't one assigned. So thank you so much for the honor to present to you today. And
Right.
questions?
Thank you so much, Janine. I'm recognizing the audio problems. Nevertheless, I think that most of the information went out, and everything is here in the slides. So I will be encouraging everybody to then read the information that was provided on each of the slides. I think that, Franco, if you could have Janine and I then do the Q&A. There were many recommendations, for example, deciding on an adult-child ratio when you have family events. That's fantastic. The head count as well. Yes, 15 went in, 15 must come out. Never too late to learn to swim. Have skin screenings as well. If you're noticing more lesions or spots in your skin, it's very important that then you go to a dermatologist and try to have some skin screening to make sure that they are just normal and nothing to be worried about. And yes, we need to remember to do the sunscreen, applying it 15 to 20 minutes before, not when we are feeling like, oh, we're burning up. So, make sure that you're wearing the sunscreen way before and reapplying. I love that recommendation about the cooling centers by your city or the county as well. And also, if you know of somebody that is living alone, especially if that person has any mobility issues, when the weather is very hot, then it's important to check on others as well, because they probably may not be able to make it to the cooling center. So great recommendations. I think that one of the things that I wanted to add, Janine, was in terms of, one of the things that increases when in the summer is traveling as well. And we have been asked about, the use of face masks now. Not everybody it's sure if they need to wear it or not, but I think that the recommendation that has been given is to wear it when you are in crowded spaces, especially when it's indoor. If you're traveling or flying, if you are going through the security lines or at the gate, it's important then to wear a face mask, and then you can take it off when you are inside of the airplane, or when if you're you can get away from people, because once we are in the airplane, then the ventilation system should be helpful. But nevertheless, if you feel like you need to wear a face mask, then I think that's a good thing to do as well. And then with the cookouts as well, any food that is out, especially when it's very hot, more than 2 hours, then you have to take some precautions as well. So with the consumption. So
Well,
plenty of,
that's a really good, I did not include that, but it's so important because the food can turn bad and you could become sick from it. So yes, that nice barbecue and the mayonnaise potato salad, it's not maybe
yes,
good 2 hours later for
yes,
sure.
exactly, exactly. But thank you so much. I think that I saw one question. Let me make sure that I'm asking. What is one thing that you want folks watching that they should take away or that they should walk away with? The one thing more than anything. Oh, there were so many pieces of information, very good ones. So that's a tough one, but what will that one be?
I think preparation. What do you plan for today? That will be your one important item to consider because if you're going to the beach, you're going to plan differently than if you're going to a pool. Or like Griselle said, if you're having that summer barbecue, how are we keeping the food fresh? So perhaps considering this is what I really like to do as an outing with my family and consider the ages. So maybe we talked about there was an image I had in a slide with a checklist. So you could have a checklist for your day to go to the beach. I
Mm-hmm,
need an umbrella, sunscreen.
mm-hmm,
I want to make sure my grandson, who's 3, that there'll be two of the adults with him if he wants to splash along the lakefront water. So putting your list together will give you a lot of confidence that you can go forward on a day that it might be hot, but you have a plan in place. And where can you go to cool down after? So you can make your lists or consider again what are your goals for the day and how you'd like to spend it. But also recognizing that summer is a time where, those 4,500 deaths from drowning, we really want to prioritize water safety, the heat safety as well, and just so you can enjoy your summer.
excellent. Thank you so much. Yes, don't leave anything to chance. Prepare. Let's
Yes, that's
prepare
it.
so that we can enjoy the summer. Thank you so much, Janine. I think that we then would like to let you know about upcoming programs that we have here for you. Let's see. Perfect. Let me make sure that I have my remarks. Um, Take charge of your health is the first one. This is a 6-week workshop that, sorry, I'm managing a few buttons at the same time. So a 6-week workshop for people with ongoing health conditions in which you learn how to build skills to gain confidence, better manage your health early, and lead a more active life. Over the course of 6 weeks, we discuss goal setting, nutrition, physical activity, medication, and pain management, as well as effective communication and strategies for working with healthcare professionals. The next workshop is coming up. It's going to start on August 6th. It's here on campus at Rush on Tuesdays from 10 from 1 p.m. to 3:30 p.m. To register, please call us 1-800-757-0202. Then we have mindfulness one-on-one. I think we have a couple more spots available. So call us right away if you're interested in this class. This is a 4-session class that teaches participants simple mindfulness skills to improve self-awareness and ability to manage daily stresses or cope with chronic conditions. The next class also will be held here at Rush the Rush campus on Thursday starting August 8th through August 29th from 1:30 to 3:30 p.m. August 22nd will be held virtually through Zoom and they will explain a little bit more, but about that, but the class is in person. It's $20, so a minimal fee. However, please don't let that discourage you. If you need a scholarship, let us know. Again, the number to call, 1-800-757-0202. A Matter of Balance is a 8-week session workshop for individuals who have begun restricting their physical or social activity because of a fear of falling. The workshop utilizes problem solving, confidence building, balance improving exercises, cognitive restructuring to help participants prevent falls, improve their health, and regain the ability to do what is most important to them. The next workshop will be held on campus at Rush on Tuesdays and Thursdays, starting August 13th through September 5th from 10 to noon. 1-800-757-0202, you know the number to call. Shaman Senior Voices, which aims to empower older adults to discuss what matters most to them as they age, wants to hear from you. Please consider joining your wisdom on why it is important for your healthcare team and your loved ones to know your goals and your wishes and what matters most to you. You can do that by visiting bit.ly/record my story, or you can scan the QR code on the screen, and then that will take you to the platform. Our next lecture is Staying Connected, Technology and Telehealth, and it's going to be taking place on Wednesday, August 7th. You know the time is 1 p.m. So we want to see you there. We hope that you can join us as well. And as always, feel free to give us a call. If you would like to know more about our programs, the 1-800-757-0202 is also the number for registration. If you feel that you would like to speak with one of our social workers, feel free to give us a call. For now, thank you so much for joining us today. Thank you again to Janine, Franco, and Hannah, and we hope to see you soon again. Thanks.